a grow abnormal bed. God, so abnormal cells na ye be tumor. The tumor na bit me cancer. But fibroids they no cancer. Into the screen we can say non-cancerous growth in the uterus. Na so uterus no baby oba wa wodie bibia wono. That's the only place ubehu sa fibroids no one. In other words, who cancer, they say be a cancer, lung cancer, stomach cancer can be but fibroids there. I will be oba baby wa wodie wono your reproductive reproductive product area one with the picture later on. What now you said the cancer growth in the uterus that can develop during the woman's childbearing age. Or by say we will do baby which now one. In other words, we won't fibroids or aquada say be one bone inside 1 year young. Obia we buni say we which me and yama na in childbearing age. So and mbano no who fibroids. And so yamba yari a for fibroids only women. The cause of fibroids in a so as a way canon is not well understood. But we say some of the risk factors include the family history. Maybe a woman will be a between a parasidia maoba. Nevis obesity casier is also a hunsa. In an quaranso a woman poverty and term. Then say near come once and yes, if it may be a bear 1680 when that's bear 1230 gram per night. Then yes, surprise is we see more fibroids. I mean, a kubu again from Sogo, Society of Obstetrics and Gynecology of Ghana. What me research who say almost about 50% of Ghana form Bano has a problem with the fibroids. The fibroids in instance, but then the one who say who are fibroids, say the picture where can who should see heavy bleeding, bloating, protruding belly. Obo was in the front, I can see as one yet when you say fibroids na aminaya reproductive dysfunction. Reproductive dysfunction is a based upon baby fibroids in one, a bit of preventive pregnancy, a bit of when there's a depression. In a frequent urination, I mean, and the next step, next slide, explain more. In a constipation, there's a pelvic pain. So these are some of the signs, not the symptoms. Also, who say a day for fibroids. To continue, how do I know? Say heavy menstrual bleeding. Say the mechanism. I mean, environment munim, Ubu Homas or Shapada, a bit baby 2-3 hours a cramp here so by but a heavy breathing, I'll be already share when I within 1 hour, no self sun. So heavy breathing does it keep on constantly changing the partners. If it's a menstrual period that lasts more than 1 week, and it's one of the signs in the bee. In a pelvic pressure or pain, same because of Dunku, when I say, oh yeah, in a frequent urination, with hydrogen so. Oh, and for the next one, because the difficulty emptying the bladder. Said Johnson on our blood. So one to mean Johnson and check Johnson do be not so called Johnson, then constipation in the backache, to me call with now light pain, and those are some of the symptoms for fibroids. Oh, you can't feel reproductive, baby. I would I mean, this is it. Oh, so my case I may has seen ovaries. Oh, when I'm Cusiano, Mumbai, your woman now Cusia, Bema, Wumbenin, ya wood that. The same nana would just 2 weeks in your bano. Cusio the woman, we are seeing over Wabe, yet ya wounded, and this and Bema, you produce sperm all the time. In this, who of Letia, Cusiani Fria, not for Philippine tube, Mr. Nabaha. It's only Bermanish here, vagina, and also ejaculated sperms now. Then they form a pregnancy, they implant in the uterus. That's how it is. Now, fibroids in the womb will be your body just this area, or woody area, I say, in Kwana. The next slide, any, when I say when fibroid sanity. It's only your reproductive area, no Kwana side, we say them kind of womb. Your lungs and not your stomach and not in part of the body, only the reproductive place, The fibroid net is saying sanity. This outside. A bit me a to say grapefruit, and side, tangerine side, like a strawberry side, all the way to the side like a grapes. These are different types of, fibroids. These are how they look like. So that one thing. The treatment when you can treat by the symptoms, medication in the surgery. So medication and then I'm going to drain at the bama. But for purpose of the presentation, maybe some focus on the surgery. Surgeries, you will surgery, 3 types of surgeries. The can your friend hysterectomy, and it's just a bit of operation. No, I wouldn't need the whole thing in front. You are wouldn't front fibrosis in a connect for and I know that you try one no. The second surgery is on a friendly uterine myomectomy. And no, you be trouble, you be trouble. Not doctor not going for invasive surgery, so better not go home now we use our fibroid in the amount. And baby Samokaya, maybe for move on man. She did that and send go to me inside. I wouldn't ban. Said I'm a can. Fibroids nibble baby can prevent pregnancy. Don't know woman who is on me ultrasound and written, then they had to do a surgery to move on the fibroid for a year and send go to one. In a test surgery, so I was said to be a friend laparoscopic surgery. And no. Yeah, you 2 you are my cania in a camera so one. Yet the show frumano, yet you never show. Yet the show we are nerve in channel, benkum, my incision or ho, then in front of my incision. A quantum the another prohibition, network call you frunomo. Camera one no, who camera no TV so. Oh, now do the bashine change you know. So surgery we no. Apasowa no saa de no dia show na apaso no to wo dia de na shem na wo de ne so move no wo hwe camera no be fibroids mo nwa wo nkete no wo betumi twitwa ne na chesa for wase through the vagina na chesa we yi dia mo laparoscopy saying that's how it is it 20 year normal p no be krampo say bi oba mpo so be obiom the so called tubal ligation say abechi chu Philippine to the unfa ovini tumba mbanyim bi no. If soon child or who sans near Singapore, near the so would be a man to miss any laparoscopy surgery. That's how it is. And yet too invasive to say you trow that so see upon me and burn out to Prana won't heal here. To only small incision a yen or sign here and to me the same day grandpa would be coffee. Yeah, that's all laparoscopy. So these are the 3 surgeries. You bet me a the fibroids in a fluid amount. When say many people who can't say and so operation and accumulate one through into your baby says so. We say so when you're so what happened if fibroid left untreated? Fine. If left untreated, fibroids can continue to grow both in size and numbers. They are what I don't know, which my young can see it. And as grandpa said, people between our connections are those who are young, and as the tumor also take over the uterus, symptoms will get worse. In order the pain will increase. Maybe so who bleeding so the bleeding is going to be heavier. They can accompany with severe cramps. More menstrual cramps. Now the time is severe menstrual cramps. But the boys say you want this operation to fix it for you. Into fibroid, sanity presentation endorsement. Into the better preventive, and it's saying we exercise, we show diet in a weight. Some kind of obesity is one of the risk factors. So we won't get any more weight near. So these are some things that won't prevent it. So be develop fibroids. In the prevention continuum. So I say also recommend say add plenty of fresh and cooked green vegetables, fresh fruit, legumes, and fish to your plate. The Mediterranean diet is one of the ways to do it. People come Mediterranean diet. You feel Mediterranean, but that's what they recommend. Mediterranean diet, vary by country and region in the Mediterranean, but the general is high vegetables, fruits, legumes, nuts, beans, cereal, nut grains, fish, in an unsaturated fat such as olive oil. It's usually in the low intake. These are some of the Mediterranean diet. These are things sometimes it can prevent a Maybe research also shows that eating this food regularly help lower your risk. Mediterranean diet. And the other hand, also, but just we didn't so red meat also increase your risk of getting fibroid. Fibroid disease. And this is the conclusion. It's the Bible, Hosea chapter 4 says, my people are destroyed for lack of knowledge, because you have rejected knowledge. I also reject their children. In the way, young friends share to Jum. So that baby American and young one, woman of Ghana, Master Bam with Jan one Kakamia. Kachom is a very big problem in Ghana. What they can do, Nikanadi. The base year is a very quick one, just 13 slides. Now, make more questions. It's more questions in beer. Yeah, no. Why? Me that say.
Dr. Ampachayan said that me part away the carbon for 2 minutes be. I can because the be a feeling now will be a basunti wa metinti will for 2 minutes be. I was sunrise no kakre be a nature security with the questions and have me part out. Okay.
All right.
Yes.
So when they make me so I screen I did the whole thing. Okay. For sake of 1 man terminal, we didn't say a small shanty, yes, will be. You can't yale friend fibroids, sabi a yamba yari and yambema. Na some kind of Society of Obstetrics and Gynecology in Ghana. Woman receive Ghana and Bano, almost 50%. They have this fibroid, a big problem. The fibroids, so cancer. It's non-cancerous growth. Nina cell started way body a male sinker community and my chair upon the community. Abnormal when they grow, baby cancer cells can come out the back. Fibroids, 2 months there, and cancer. Now one a woman, they are bearing childbearing years. So, but say we put inside what is over to me a woman a year. So, no, so probably say because a childbearing age, if you go as look at 16 years to 45 to 49 years old, depending on who is defining the childbearing age. The sign one more motive and you say, what a man a year in the fibroids a year more. And the cause of fibroids, is not well understood as a representation came. But some of the risk factors are at least why between a canon. A bini family history, umami will be one war bar or pass the amount. In a case here, obesity. And so in a koda, you need a period in term. Early onset of puberty. Dancing a can sit it no case in Pelenum for 15, 16, 17 period. And that as little about 10 years, 11 years, and this also is a risk factor for getting developing fibroids. There are symptoms. Symptoms being said, and I say, how do you know? Say you have fibroids, heavy bleeding, bloating, protruding your belly. Your friend I said when you fibroids, na reproductive dysfunction, depression, constipation, and I say frequent urination, which do so pee. And I said pelvic pain, and to further to explain that, and heavy breathing. And I can say, Mumba Muna Mobehu, so we'll be there. How many times often do you change your part? So heavy breathing there, would you share when I check now for no so the same biome? That's another sign. The menstrual pregnancy lasted for more than 1 week. Some cultural say we don't pelvic pressure or pain, we don't frequent urination, difficulty emptying the bladder, we do Sancho Tarban, they would do so blood in that Johnson. Won't mean and Johnson in frigo, and Chebiana Johnson. That leads to what we call frequent urination. If constipation, won't mean Jonah, Nimpa there, so you're normal there. At least you have a bowel movement every day. It's good for you. And if it's a backache in a leg pains, it's a sign of say symptoms are just when you're fibroids, you know. The fibroids is who baby can be a what dear one. In general, who your lungs, any part your stomach, and something like that. The reproductive area, say na mature, say these are the ovaries. So about Benjamin ovaries, so who ovulate here, eggy, a bit fresh, now by uterus. Now, only Bermanisia, then Ninsanaba, then a plant in the uterus, then Ninsanana, Shasano. No, Banso, ovaries could share would be womb, your womb near their womb produce biome, and this a Berma, you produce sperm all the time, Yeah, so fibroids, womb baby, this area. The next picture will show you any. So vagina was a form has saying the uterus in the Adina Woma, Abajia Conjo was so it's something that we need to do something about it. This is how fibroids look like. It meet me a super is a grapefruit, grapefruit, anka, tangerine size, strawberry size, all the way to grapes. Almost different sizes. That's how they look like inside your body. We year two on your picture, your day. Treatment, you can treat the symptoms in a medication. You be more draw now, for sake of this presentation, I want to concentrate on the surgery. Now, surgeries, you can say there were 3 types of surgeries. First one is called hysterectomy, and you be what would you just a year, not just a year, a year for what they are and the fibroids, and to member, but they remove the whole thing. Now, second surgery is between and the uterine myomectomy, and operation is invasive surgery. You better depend on how big our better is 2 inches or 3 inches or whatever it is. Next, what corner fibers or we in the amount. The third surgery, your friend laparoscopy surgery. The no can say, Unfuma, you the two bishops out to Kania in a camera one. You're linking to a TV or honomo on the screen. I'll be with asset to television. Now, Unfuma Nans no about when Chemusa been coming in Finland, so be another incision on one more. No, the probe ashim, sa probe no, a pasoa, no cativisa into the commissana, no shot camera no, or move, no between to trust Faros a yanket and kitten. And so Trenisana, what Buffer was said to the vagina, and she said, we yama. With Fabros yanket and kitten, yes, I said, read the mouth. So laparoscopy and see to me the year normal P. Sir, make us say, umperso beubium, no perso tuber like it, umperso or frequent tube, must say the bear over in by end to member, uterus one or one. You between the Hamasha, the name Singapore, umperso be mad, you between son the amount. So laparoscopy, that's how it is. Yeah, these are the 3 types of surgeries. We make me here to cure the fibroids. Namika surgery. So surgery, nipple peaceful surgery. JB will be some say the fibroids was a man treaty a bene. So when treaty a fibroids no bet me I can see the one can get no bet me I can see. And that's going to say people bet me develop up account. Now once that happens, pain the tumor, pain will increase. The bleeding is also become heavier. It can even lead to severe cramps. Say more and more menstrual cramps. You know how they're very, very painful. It's when treated, that's the cause of, what is going to lead to. Now, prevention, regular exercise, we said that if you're would know what you wait and so say they are make and one of the risk factors is obesity. So your chance of getting fibroids is very high. Continue, eat plenty of fresh and cooked green vegetables, fresh fruit, legumes, and fish in your day. The young say Mediterranean diet. What is Mediterranean diet? Mediterranean consists of vegetable, fruit, legumes, nuts, beans, cereal, grains, fish. On the other hand, so we should stay away from eating the red meat. The red meat, only consists as a risk of which means fibroids. So we should stay from that or eat it moderately. That's what I have. The conclusion, because we say my people have been destroyed because of lack of knowledge, because you have rejected knowledge and I also reject their children. The basic yebisa questions kakra.